Well, good morning, Dr. Lee. Sorry for not being able to be there live with you. I am actually on a plane to my daughter's graduation. She graduates from Whitman College in Walla Walla, Washington. So we're taking my father-in-law up. My wife and I are taking my father-in-law up to see the graduation of his youngest grandchild. So very excited. Actually, my story begins with my father-in-law, Bill Meyer. We call him Poppy. Poppy's had two consecutive bouts with cancer. His first was in the Bay Area, California, and his second was here at Asante. And both of those journeys, I would have to be honest with you, were difficult journeys through cancer. Not just the treatment of cancer, but the journey he took as a patient. The multiple stops, the multiple appointments, the coordination of care. And both my wife and I are in healthcare. My wife is a nurse. I work at here. I'm the senior vice president at Road. So I know our healthcare system very well. And even I couldn't help navigate some of the multiple appointments he had to take. So that slide in front of you is an example of another patient's journey, but we lived it with Poppy. 25 different appointments, multiple different radiation, the follow-up calls, the different supplies that had to be delivered, and really the different locations. So our vision for this project and the overall guiding view began with the patient's journey. We wanted to provide a coordinated and integrated regional cancer center through Asante, how we can deliver medical excellence through a value-based treatment system where patients and family come first. That medical excellence and patients and families come first are key. Through our steering committee, through our partnership with HOA, through the long hours working with the providers on how best to design this space, we always reminded ourselves of that patient's journey. And we wanted to make sure we provided the best clinical care possible. So that, we always harken back to that picture, and you see the table rock on the bottom and the building image on the top. This was sort of an architect's rendering of the cancer center, its early stages. We wanted to embrace the beautiful environment around us. So when you tour and see the cancer center, you're going to be looking out at some beautiful, beautiful surrounding areas. But just imagine from the patient's perspective, their journey is inside that building, inside that experience and the caregiving that's taking place. So having a little bit of a bright spot in the views they see, we thought was golden for them to have within a cancer center. The project vision, I mentioned top-notch cancer care, coordinated care all the way through. How we navigate the care, how we put support services, and I'll talk through some of the facility components we have that's there for the patient. But we wanted to make sure their journey didn't stop just within the cancer center. How we provided educational offerings, how we provided follow-up care, and how we really kept that patient in our minds and hearts all the way through their journey, through however their journey resolves itself, but we wanted to be with them all the way through their journey. So let me give you a little bit of specifics on what's inside. And this is kind of a floor by floor. This is the Hyman Cancer Center. Later on in the morning, David Kenyon is going to talk through the Spears Cancer Center. Both of these cancer centers are really Asante making a major investment in the regional care of cancer care. So let me talk about the first floor. We have our CT and PET imaging on the first floor. We have a separate entrance for the imaging services. So easier for the patients to be dropped off on the grade level and walk right in for their imaging services. So CT and PET is on that ground floor. On the second floor, we also have a drop off directly on the second floor. The slope of the hill allows us to have two direct entrances. So on that second floor, we also have a direct entrance for the staff and patients to come through, really limiting the number of stairs that a patient would have to take. There we have the offices of HOA, our great clinical partners. You're going to hear from Dr. Rizvi in a little bit. We have hoteling space for other providers who need to provide care, and they could be specialty surgeons, specialty care, palliative care physicians that are coming in and visiting with our patients. There we also have the lab, we have the cafe, and this is where they'll start their journey with registration. On the third floor is where we have the infusion suites. And at this point, you'll see, if you walk the site, just the gorgeous views out the window. But the more important view is the line of sight for the clinicians. We designed these infusion bays so that there is a nurse on either end of the infusion bays with direct lines of sight to the patients during their entire infusion therapy. And that's very important if a patient has clinical challenges or just maybe needs that we want to make sure we're attuned to. They may nod off and take a nap. They may want to have a little bit more privacy. If you have direct line of sight with that patient, you can read their cues and tend to that patient. And that was key in the design of that area. I mentioned a few things about who helped us design and build this cancer center. So the slide before you is the partnership between Asante and Hematology Oncology Associates, HOA, but also the design team. So Malin was our design, Adroit was the general contractor, and we hired a regional specialist who really focused on how cancer centers are built and function, and that's oncology resource consultants. This group is the one that pulled together the initial construction efforts, the steering committee, and led the efforts early on. Some of the key milestones, as you can imagine, we designed and built and opened up this cancer center through this historic pandemic. The focus of our clinicians to be able to do things more virtually than on site was a challenge. Our construction crew that had to navigate all the OSHA requirements on performing their duties on site and being vaccinated or not vaccinated and wearing masks, and the challenges of the pandemic in the construction industry still continues, but it certainly existed for this project. But we maintained our key milestones, we maintained our schedule, and we maintained our budget. And we've successfully opened up both cancer centers on time and are now seeing patients. So we've met the challenges through this difficult time, and we are now caring for the patients of this region. And that really begins with probably the most important page I can leave you with is on this org structure. The core partnership really is the medical director leadership under Dr. Rizvi, the clinical leadership with Wendy Vaughn as our lead nurse, and the administrative leadership of Brian Murphy. That triad really is the hands-on presence leadership that this cancer centers both require. And I have full faith in both Dr. Rizvi, Brian, and Wendy to not only lead the rest of this presentation, but to lead this cancer center and talk through its many wonders and intricate design there for the patients and the patient's needs. So once again, I'm sorry for not making it live. I do wish I would meet you down the road if you come back to visit us, and I appreciate your time with us. Thank you.